Hello and welcome to Soul Sessions. Thank you for joining us this week. Today we're going to be talking about cervical cancer. The opinions voiced on this program do not necessarily reflect the views or opinions of the AFCC, its staff, volunteers, board of directors, or underwriters. Soul Sessions Through the Eyes of Us is a safe place for the panel to discuss various local and global events and provide information on current topics that affect African Americans. Well, this month, January, is Cervical Cancer Awareness Month. So we're going to be learning more about that. And today we actually have a guest panelist, Peggy Bartley, and she is the health educator for the Every Woman Counts program. And she's going to be giving us a presentation on cervical cancer.
Okay. So as Marla said, I'm with the Every Woman Counts program, and we help people in California get free breast and cervical cancer screenings. And so because January is Cervical Cancer Awareness Month, I'm just going to be talking about cervical cancer prevention and screening. While breast cancer is a result of a lump or visual abnormality, that can become cancerous. Cervical cancer grows very slowly, and the changes can't be seen outside of the body. Cervical abnormalities can be found on screening tests, and they can be removed before they turn into cancer. So cervical cancer is 100% preventable. Where is the cervix? So the cervix is located at the opening of the uterus. The uterus is, of course, where it's the womb where a baby would grow, and it basically joins the vagina to the opening of the uterus. So what causes cervical cancer? So cervical cancer is caused mostly by the human papillomavirus, also known as HPV. It actually causes almost all of cervical cancers. HPV is the most common sexually transmitted infection, and most of us, about 1 in 4, have HPV. And most of the times our body just clears it on its own, like it does with a common cold virus. Where we have concern is when the HPV does not go away, and it can cause all kinds of, actually 6 kinds of HPV-related cancers or genital warts. So like I said, it's a commonly transmitted sexual infection, and it's caused by any skin-to-skin sexual contact or any kind of sex. So what are the risk factors for HPV and cervical cancer? The most serious risk factor is not getting screened on a regular basis. And I'll talk a little bit more about that later on, about what the screening schedule is. It's important for us to follow up on any abnormal PAP or HPV tests. Another risk factor is having a weakened immune system, having sexual contact with a high-risk sexual partner, having multiple partners, unprotected sex, and tobacco use. Now, the tobacco use is kind of related to our immune system, because using tobacco can decrease our immune system and make it more difficult for our bodies to fight the HPV infection. So there is a vaccine now that prevents HPV. The vaccine has been around for about 17 years, and it protects against HPV-related cancers, and there are 6 of them. And it also can protect against genital warts. The 6 HPV-related cancers are cervical, which is the most common, penile, anal, vulvar, vaginal, and some head and neck cancers. We like to give the vaccine to children between the ages of 11 and 12. The reason being is most of the time they have not been exposed to HPV yet. And their immune system is higher at that age. We can, however, give the vaccine between the ages of 9 up to the age of 26. Clinical trials have shown this vaccine to be safe and effective. So cervical cancer screenings consist of a pap test and an HPV test. So this is what our cervix looks like. And at the top left, you can see that it's smooth and shiny and clear. Then we get to the bottom left side, which is unclear. And a lot of times when there's some unclear signs, usually it could be a slight infection, it could be a menopause or pregnancy. Those type of hormonal changes can cause some little changes to our cervix. Now, when the cervix has some abnormal cells, this is where those cells can be removed. They can be scraped off before they turn into cancer. And that, along with the vaccine and the regular screening, is what makes cervical cancer almost 100% preventable. So here's our screening recommendations. Beginning at age 21, regardless of sexual history, a person would have a pap test. And if it's normal, they wouldn't have to have another one for 3 years. Now, between the ages of 30 and 65, we recommend that you talk to your medical provider about what screening schedule is best for you. So there are 3 options. Only HPV testing, and if that's normal, you wouldn't have to have another one for 5 years. Having a co-test, which is a pap and the HPV test. If those are normal, again, you wouldn't have to have another one for another 5 years, or a pap test alone, which is every 3 years if the results are normal. So let me talk to you a little bit about our program, and then we can have some answers to any questions. We offer free cervical cancer screening beginning at age 21, breast cancer screening beginning at age 40, and any breast diagnostics for any age or any gender. We can offer free diagnostic screenings. So the eligibility requirements for the Every Woman Counts program are live in California, have no health insurance or Medi-Cal. If a person does have insurance, they can't afford their insurance premiums, their insurance deductible, or their insurance co-pays, they can come to our program as well. A person would also need to be low income and are of the screening ages that we just talked about. So this says there are 2 ways to find an Every Woman Counts provider, but there are actually 3 ways. So one is to call this 1-800 number. This number is automated. The beauty of this, though, is there's the ability to answer or to give information in these 18 different languages. Problem with this is that if you have additional questions, you can't really ask because it's automated. The other option is to go online, you put in your zip code, you say how far you're willing to travel to a provider, And then it'll list, then you hit search and it'll list all the different providers in your local area. Again, you're unable to find or to ask any specific questions that you might have about the program. So what if a person has breast or cervical cancer? We have a referral program for treatment. It's called BCCTP, which is the Breast and Cervical Cancer Treatment Program. And Every Woman Counts would refer a person if they've been diagnosed to this program so they can receive free treatment. So I mentioned there were 3 ways to find a provider, and this is the 3rd way, is calling me directly. 530-345-2483, extension 203, or you can also send me an email. The beauty of this is I can help you find a provider. I can even call and make an appointment for you. And I can also answer any additional questions that you might have. Okay, that's it. Are there any, let me stop my screen share. See if you have any questions for me.
Yes. So I'm wondering if you are getting the HPV vaccine, is it just one shot, or like do you have to get any like boosters, or how does that?
Well, that is a great question. And I'm glad you asked it because I forgot to mention it earlier when we were talking about the vaccine. So if a person gets the vaccine before the age of 15, they only need 2 shots. After the age of 15, they need 3 shots. And so far at this point, no booster is needed after you get either the 2 shots or the 3 shots.
Okay.
Great question. Thank you.
So I was looking at the details, and just to give you a little context, I'm older. I'm in my mid-40s. So I was looking at where it says pap test.
Mm-hmm.
Is that different from a pap smear? Because that's what it used to be called when I was younger.
Right. That's what it used to be called when I was younger too. But now they call it a pap test instead of a pap smear, but they're exactly the same thing.
Okay.
Yeah.
And then too, it was talking about getting that test every 3 to 5 years. I thought it used to be every year. Am I mistaken, or what?
No, it used to be every year. Like when I was growing up, right when you like went for birth control, let's say, they would start doing a pap and you would have it done every single year. But, you know, a lot more research has been done about cervical cancer. I mean, now we know that it's caused by HPV. And now we know it's a slow growing cancer. And so people don't need the pap test every single year. And then, you know, obviously also now is the HPV test along with the pap test. The now person doesn't, if both of those are normal, they don't have to come back for 5 years or have a repeat test for 5 years. It is still recommended that a person goes in once a year to have a pelvic exam, however.
I was wondering, why is the HPV test only recommended for women 30 years of age and older? Like, can somebody younger get it if needed?
So the reason they don't start that until a person is 30, because under 30, our immune systems are pretty good at fighting off the HPV. So most of the time, if a person is under 30 and they're sexually active and they have HPV, the body will fight it off before there's any treatment needed. That makes sense?
Yeah.
Yeah. So we started at 30, you know, 30 is kind of the cutoff where our immune system starts decreasing a bit.
So I remember when I was younger, I had an abnormal pap, and I had to get a biopsy and all that stuff. Is the process the same if you were to get an abnormal HPV test?
Yeah, so if they see abnormal cells or find abnormal cells on the cervix, they'll do something called a colposcopy. And that's where they use like you know, I don't know all of the details, you know, but they'll take a magnifying glass and I shouldn't say glass, a magnifying scope, and they'll be able to see clear and see where those abnormal cells are.
Does birth control have an effect on your chances of getting cervical cancer, or how does that come into play with cervical cancer?
You know, research has shown that birth control can increase your chances of cervical cancer. But of course, you know, like we talked about earlier, multiple sex partners, partners with, you know, high risk sexual partners, that sort of thing can increase our risk. Not that that necessarily goes hand in hand with birth control, but birth control in and of itself doesn't necessarily increase your risk of getting HPV.
Do you know if there's any specs on if this type of cancer affects African American community more prevalently than other communities, or how we stack into how we are affected by this disease?
Yeah, so unfortunately, I don't have those statistics right in front of me to give you, but I know there is a higher prevalence in the African American community compared to white people. But there is a higher prevalence, and there's a multitude of reasons. Of course, I'm sure you know some of it is the health disparities, that sort of thing. But race in and of itself does not increase a person's risk of HPV or cervical cancer.
Good. I was wondering if it can spread to other areas of the body, cervical cancer.
Yes, it can. If left untreated, it definitely can metastasize.
So this is the same. This is the same virus that causes warts.
Yes, it's HPV. There's about 100 different strains of HPV, maybe even more. And there's like 2 that cause cervical cancer and another strain that can cause genital warts.
Okay.
So yeah, and then the vaccine will protect against both or all of those strains that cause cervical cancer and the genital warts. Mm-hmm.
And so the difference between, so say you have the HPV virus in your body, and it starts to produce the abnormal cells on the cervix. At what point does it turn into full-blown cancer, or is it already considered cancerous even at the abnormal level?
No, when the cells are abnormal, they can be scraped off before they turn into cancer. Okay. So if those abnormal cells are left, it can turn into cervical cancer.
And like you said, that cancer can also metastasize just like a regular cancer.
Just like any cancer. Yeah. So sometimes when a person's diagnosed with cervical cancer, like a whole hysterectomy, total hysterectomy is part of the treatment plan. But yes, it can definitely spread to other parts of the body.
I was wondering if genetics have like any play in cervical cancer at all, or if it's just kind of caused by the HPV virus.
Yeah. So there can be more of a genetic history to cervical cancer that is not caused by HPV. My understanding, I'm not an expert in that, but my understanding is a lot of times it's with, it's rare and it's happens in like younger people, like under 30, under, I read a case study where a woman was 23 years old and she passed from cervical cancer. That's not enough time, even if she started being exposed to HPV at a very young age, there really wasn't enough time for it to develop to HPV related cervical cancer. So yeah, there is a small genetic, that's a component to it. That's why we start screening at 21, regardless of sexual history, so we can catch those people who maybe have just the genetic component as opposed to the HPV component.
Okay.
So are there any changes, or have there been any changes in the age where young girls are suggested to start having gynecological visits?
I don't think I got the question.
So again, I can only draw from my experience. From my experience when I was younger, I think the first time I went to the gynecologist was maybe 14 years old.
Mm-hmm.
Is there any, and I don't remember, because my grandmother was a nurse and she just took hold of that whole situation. So
okay.
I don't know if it was because of her or if that was just a regular thing. It seemed like it was a regular thing at that time, but like you said, you start the screening at 21. Is that the new age where women are supposed to start their gynecological experience, or is it younger still, or what is the suggested?
Yeah, it's 21 now for the pap and the pelvic exam. I mean, obviously, if somebody is younger than 21 and they want birth control, let's say. Now, my understanding is, so when I was younger and I wanted birth control, I had a pap and a pelvic, the whole thing. My understanding now, and I only kind of know this from my own daughter's experience, is they'll give birth control without that whole pap and pelvic exam until they turn 21. So yeah, all that's changed from, and I have a number of years on you. So, but all that's changed, from when I was young, when you were younger,
There's a lot of, so is there a reason why they pushed it back like that?
It was mainly because they found out where, cervical cancers, is caused, most cervical cancers are caused by HPV. So that was one. The other thing is that it was a slow growing cancer. And so a lot of these exams and, the pap test, they were just unnecessary.
Okay. You have any more questions?
Not necessarily. I just learned a lot, and thank you so much for all that great information. There's a Every Woman Counts program out here in Orville, is there? Or how does that work?
Well, so my region actually is 16 counties in Northern California. And we have health educators and this Every Woman Counts program all throughout California. So it is a state-funded program. And so anybody, I mean, even if someone from Southern California sees this, they can call me and I can get them in touch with the people in Southern California. or they can call that 1-800 number, or they can go online and find a provider. But it's all over California. And every single state has their own program just like this. It's just called something different in every state.
Okay. That's all I have. If you have any more questions.
No, sounds great. You gave a lot of great information.
Good.
So we like to thank you, and we
Thank you.
definitely have been working on a lot of different topics that we can talk about going forward this year. So hopefully we can make this a monthly, if not bi-monthly occurrence to have you on our show. We really appreciate you.
Yeah, that would be wonderful. That would be wonderful. I'd love to, talk a little bit more about breast cancer too,
Okay.
and some of the things we
Sounds
could.
good.
So maybe that'll be our next one.
Awesome.
Perfect.
Sounds good. Thank you, Miss Peggy Bartley.
Okay, thank you so much. I appreciate it.
Appreciate you.
All right, now we are going into the LEAD program with McKenna.
Hi, I am McKenna and I am the community coordinator for the African American Family and Culture Center. LEAD stands for the Leadership in Equity, Action, and Development. The goal of the LEAD program is to promote and protect a tobacco-free lifestyle for all Butte and Yuba County residents. We believe passionately in advocating for health equity and environmental justice for low-income people and in communities of color. Tobacco use is the leading preventable cause of cancer and cancer deaths. It can cause not only lung cancer, but also cancers of the mouth and throat, voice box, esophagus, kidney, pancreas, liver, bladder, cervix, colon, and rectum, and a type of A leukemia. Each year, 6,600,000 people in the U.S. are diagnosed with 343,000 people die from cancer related to tobacco use. We have made progress. More than 1 million tobacco-related cancer deaths have been avoided since 1990 because of comprehensive cancer and tobacco control programs. Every detection of cancer and improvements in cancer treatment. However, not all states or all people have experienced the benefits of those efforts. When states make greater and longer investments in comprehensive cancer and tobacco control programs, few people use tobacco and get or die from tobacco-related cancers.
And states and communities can support comprehensive cancer control programs focusing on cancer prevention, education, screening, access to care, support for cancer survivors, and good health for all. They can fund comprehensive tobacco prevention and control programs at CDC recommended levels, make tobacco cessation treatments more available to people who want to quit, protect non-smokers from secondhand smoke in all indoor public places and work sites, including all restaurants, bars, and casinos. If you were asked to describe the relationship between tobacco and cancer, you might think of lung cancer. It's true that smoking tobacco products, including cigarettes and cigars, causes 9 of every 10 cases of lung cancer. But tobacco use can cause cancer almost anywhere in your body, including bladder, blood, cervix, colon and rectum, esophagus, kidney and renal pelvis, liver, lungs, bronchi, and trachea, mouth and throat, pancreas, stomach, and the voice box or larynx.
Smoke from cigarettes, cigars, and pipes have at least 70 chemicals that can cause cancer. Every time you breathe in that smoke, these chemicals get into your bloodstream, which carries the chemicals to all parts of your body. Many of these chemicals can damage your DNA, which controls how your body makes new cells and directs each kind of cell to what it is made for. Damaged DNA can make cells grow differently from how they're supposed to. These unusual cells can turn into cancer. Tobacco use causes at least 12 types of cancer. Cancers linked to tobacco use make up at least 40% of all cancers diagnosed. Cigarette smoking causes 3 in 10 of all cancer deaths.
The problem is people are still dying from cancers caused by tobacco use. People who use tobacco or are exposed to secondhand smoke are more likely to get and die from cancer. Tobacco smoke has at least 70 chemicals that cause cancer, also known as carcinogens. Lung and colorectal cancers make up more than half of all cancers linked to tobacco use. Secondhand smoke exposure causes about 7,300 lung cancer deaths among non-smoking adults each year.
As we keep saying, tobacco use is the leading preventable cause of cancer and cancer deaths. About 3 in 10 cancer deaths are caused by cigarette smoking. Lung cancer is the leading cause of cancer smoke for both men and women. Quitting tobacco use at any age can reduce the risk of getting or dying from cancer. Getting screened for cancer can lead to fewer people getting or dying from some tobacco-related cancer in the cervix, colorectal, and lung. Healthcare providers can ask all patients whether they use tobacco products, advise those who do not use them not to start, encourage those who do to quit, and provide help with quitting. Help patients understand what cancer screening tests are needed and are best for them. Make sure their patients are screened on time. Let patients know that there is no risk-free level of exposure to secondhand smoke and advise them to avoid it. Know which screening and counseling services are reimbursable to their practice. Everyone can quit using tobacco or never start. Quitting at any age will help you avoid getting cancer. Ask a health provider for help quitting and call 1-800-QUIT-NOW for free assistance. That is 1-800-QUIT-NOW. Encourage friends, family, and coworkers to quit using tobacco. Teach family and adolescents about the health risk of tobacco use and secondhand smoke. Make their home and vehicle 100% tobacco free and not allow anyone to use any tobacco products around children. Learn what cancer screening tests and vaccines are right for them and their family. Quitting smoking can also add as much as 10 years to your life compared if you continue to smoke. Quitting when you're younger can reduce your health risk more. For example, quitting before the age of 40 reduces the risk of dying from smoking-related disease by about 90%. But quitting at any age can give years back of your life that would be lost by continuing to smoke. There's no safe level of tobacco use. People who use any type of tobacco product are strongly urged to quit. People who quit smoking, regardless of their age, have substantial gains in life expectancy compared with those who continue to smoke. Also, quitting smoking at the time of a cancer diagnosis reduces the risk of death. Doctors have known for years that smoking causes most lung cancers. It's still true today, when nearly 9 out of 10 lung cancers are caused by smoking cigarettes. In fact, smokers have a greater risk of lung cancer today than they did in 1964, even though they smoke fewer cigarettes. One reason may be to the changes in how cigarettes are made and what chemicals they contain. Treatments are getting better for lung cancer, but it still kills more men than women than any other type of cancer. In the United States, more than 7,300 non-smokers die each year from lung cancer caused by secondhand smoke. Secondhand smoke is the combination of smoke from the burning end of a cigarette and smoke breathed by most smokers. And that has been the lead updates. Thank you.
Thank you, McKenna. Now we are going to go into our programs section, where we remind you about our programs and events that we have here at the AAFCC. We would like to remind you that the opinions that were voiced on this program do not necessarily reflect the views, opinions of the AFCC, its staff, volunteers, board of directors, or underwriters. And we have some events coming up.
The African American Family and Culture Center will be holding a vaccination clinic on January 31st, 2022 from 10 a.m. to 5 p.m. Vaccines are free and no appointment is needed. Pfizer, Moderna, and Johnson & Johnson are all available to ages 5 and up for the first, second, and booster doses. Sliders Grill food truck will provide free food, and the AAFCC will be giving out $10 fast food gift cards for those who get vaccinated.
We also will be having a block party coming up. So we're throwing the 3 R's block party, and the 3 R's are reclaim, restore, and revitalize. That's what we're trying to do in this community. And that's why we're reaching out to our community, because it's going to take all of us to make it happen.
Mm-hmm.
On February 26th, we will have the block party in front of the center. We will be offering health checkups, resources, a vaccination clinic, music, food, and entertainment. Everyone is welcome, and it's a family affair because there will be activities for all ages. What we need from you is to let us know what you would like to see your neighborhood look like. We hope you will join us in creating a better environment for all. The vaccine clinic and block party are both supported by Vaccinate All 58 and CORE Community Organized Relief Effort. And our weekly programs. Each One Teach One is an after-school program for grades 2nd through 12. It's Monday through Thursday from 3 p.m. to 5 p.m. Soul Sessions Through the Eyes of Us is Tuesday 5 to 6. And we also have Personal Peace Institute. This is a free program that provides participants with the skills and strategies necessary for recognizing and also controlling angry feelings. The youth portion is on Wednesday in person during Each One Teach One from 3 to 4 p.m. The adult section is Wednesday from 6 to 7 p.m. And the Brotherhood and Sisterhood groups are on break for the next 4 months, but during that time we have a new support group called Parenting for Success, and that is every Friday from 5 to 6 p.m. This class is available in person and also online, so mark your calendars and call, email, or walk in to register. The first 5 people to attend 10 classes will receive a gift card. We have Dance Diverse. That's our hip hop and also step class that allows participants to build relationships, learn leadership skills, and also boost confidence. Everyone is welcome, and there's limited space, so give us a call if you are interested in that. That's Fridays 2:30 to 5 p.m. And also tune into our community radio station, KOYO 107.1 FM, and you can also stream online at koyo.fm. On Wednesdays at 10 a.m., we also have a radio show hosted by Dalen Whitaker, who is our project coordinator, correct? Yes, our project coordinator, and he does a show called History Right Now, so check that out as well. Please give us a call at 530-532-1205 if you're interested in signing up to participate, volunteer, or facilitate any of these programs. Thank you so much, and we will see you next week on Soul Sessions.
Bye.
Bye.